I now call upon Dr. Nikhil Nasta, who will be speaking in favor of multifocality with EDOFs and multifocal IOLs.
Give
Give
it
it
back.
back to your teacher.
Okay. Thank you so much, Nitin sir, for including me, and Shilpa ma'am for teaching me all that I know. In her hands, you put anything mono, trifocal, EDOF, they are going to see very, very well, and we know that with her expertise, and of course, the way she is. So, I'm going to speak a little bit on EDOF and trifocal technology, which is the buzzword, and it's what everyone is wanting to do. I use a lot of these in my practice, but I'm also a fan of monovision. It's a very tailored approach. So I'm just going to give you a fair view and not take any sides. Um, what we are doing here is everybody wants no dip in their depth of focus. That is the prime thing, more than the quantity that they are seeing. I believe it's all about the quality as well. I may give them 6.6 and 6 and everything, but with glare and halos, they're not going to be happy. I may give them monovision, but if they are not happy with being myopic in one eye, they are not happy. So whatever you do, you're never going to win truly. You have to be very sure about that. Hypothetically, I'm presenting a case. He's my friend Mayav. He's a 42-year-old male emetropic businessman complaining of glare and halos at night. Asthmatic on inhalers, how will he spend his time? He uses the computer, he likes to check his Insta feeds, and he reads and drives occasionally. His ocular examination is showing a PSC, OD more than OS, and everything else is normal. This is what he has, and the fundus is absolutely clear. So he says, I've never used glasses, doc, and will I need glasses after surgery? And you're like, oh, okay, now what do we do? ठीक है. IOL options, we have monofocal plus IOL with monovision, EDOFs, trifocals. Now, in the monofocal, monovision things, we are depending on neuroadaptation. The brain has to work and to adapt. Whereas in the EDOFs and the trifocal, all the heavy weightlifting is done by the optics on the lenses. But still, it is a blend of both always. So, we are going to debate EDOF as well as trifocal and see which one is going to suit him the best. This is a debate I had done with my friend Manik Nicholson, and that's what I'm presenting. Monofocal lenses give you a single focal point. The center near two focus is there in a multifocus lens, and EDOF lenses have an extended depth of focus zone. So this is the difference in the physics behind these lenses. EDOF lenses, because they have this extended zone, they don't really cause glare, halos, and whatsoever. So for vision, both near and afar, EDOF IOLs are the star. No more squinting with strain. Clear eyesight you'll regain. Now driving and readings are on par. That's what EDOF is doing for him. Okay. EDOF basically has two transition elements in the central 2.2 mm area. Small plateau of 1 micron stretches the wavefront to create a continuous focus. There's a very discrete change in the radial curvature. This is how the physics of the lens is, and that's explained over there. But there is going to be some loss of contrast for sure, because it's a focus, not a single point. It may depend varying on the pupillary size, how much is the pupil like, and if it's decentered, the results won't be as you expect them to be, which is true for any premium IOL. A well-centered Rexis which has a well-centered lens along with your Purkinje images is good. This is the modulation transfer function, which is showing us the comparison of a mono with an EDOF and the defocus positions. If we go further, EDOFs have a posterior achromatic diffractive pattern with an ecklet design. It's an achromatic technology. Again, there is a little bit of glare halo, which is going to happen, but not as bad as you would have with a trifocal IOL. This is the monoocular defocus curves at 6 months, comparing a symphony and a monofocal control. When you look at the eye hands from J&J, this is a smooth continuous transition of power from periphery to the center. There are no demarcation lines here. There's a tiny central plateau which produces a local change in the refractive power, and it has a high range of diopters available. So there are no photic phenomenon, and there's a minimum intermediate vision also that they get here. If you compare different lenses, this is showing us the defocus ranges. For vividity, it's pretty low. Okay, so these are just some graphs and technology behind it. So EDOF and trifocal, when you compare them, the defocus for a trifocal is very evenly spaced out at near, intermediate and distance, whereas in the EDOFs, it drops down near the near parts. When you go in for the trifocal IOLs, you get the best at all distances, excellent distance, excellent intermediate, excellent near vision, and the dependency on glasses goes away. So I always tell the patient, you're not going to see everything all the time, you will see everything most of the time, but sometimes you will still wear a glass, which will be more like a magnification. It's not a chashma as such, it's more like a magnification for you. Also in the font sizes, if they just increase it, to a larger font size, they get around that also really well. The quality of vision is pretty good. So with trifocals, your sight is always bright. Near, far and mid-range are just right. From books to the road, no glasses bestowed. You'll see every detail in sight. That's what it is. But different options available, 80 LISA, span optics, fine visions and so many more. They all have slightly different technology relating to the rings on them. So in the 80 LISA, it's a pupil independent style, but there's a loss of optical quality at bigger pupils. Bifocality in the periphery, and centrally it's a 4.3 mm trifocal design. In the pan optics, it's non-apodized, higher distance and intermediate light energy. Centrally, there's a trifocal design 4.5 mm and it has monofocal periphery. If you look at this graph here, it's showing us intermediate. In the pan optics, we have a good plus 2.17, and it's also showing us the light energy, so the contrast loss we can see here, and the material and the diffractive system. It's just comparing different types available to us. So pan optics, which is very popular, it has a central diffractive zone with a 3.25 near rad, almost a 2.2 intermediate ad, and it's aspheric minus 0.1. This is what the graphs look like, and it's a very promising lens. It's a very forgiving lens. It's nice. The visual acuity graphs are also seen here, the defocus curves and the MTFs without correction, which are all very favorable. The glare and halo, of course, does happen, but it's much lesser now. It's almost the same with the different kind of lenses, but it's a thing they have to live with and they have to accept. So you counsel, give a lot of chair time pre, so you don't have to give a lot of chair time post. So with an EDOF and a trifocal comparison, long distance driving is very good. Mid-range is also very good. But in the near, trifocals are a tad better. But if I have a smartphone which I can, zoom in and see, I don't really care much. Like I said, I'm more of a quality over a quantity. I'll buy something which is high quality more than just a lot of rubbish. Need for glasses after surgery may be minimum in EDOF for the very fine print, but many people get around this. They have problems with reading menus in dim lights and restaurants, but that's fairly manageable. Nighttime halos with EDOFs are minimal, but with trifocals, yes, they do happen, and they can be very annoying. Patients may say, I don't care much, I don't drive and all, but they come and sit in your OPD and they pick your brain on that. Okay, so can we use EDOFs and trifocals in all our scenarios? In a glaucoma, maybe I'll opt for an EDOF, not a trifocal. In a high myope, in a post-LASIK, in a post-RK. So certain cases we can use certain technology, but we have a whole basket. So we have solutions for everyone. I want to highlight this lens that I use. It's an Autofocus Pro. It's an Indian lens made by my mentor, Dr. R.C. Shah and Dr. Kakadia. And this gives us a very excellent depth of focus. And we've checked it, we've done a lot. It's improved technology, it's hydrophobic, and it's a good size to fit in the bag. So if you haven't tried it yet, you must try these. These are giving very promising results. This is just the checklist. We'll skip this. These are just some research done. We'll skip this also. So if I have to conclude, I don't think anything wins. Mono is good, EDOF is good, trifocal is good. You have to select wisely. Thank you.
Thank you, Nikhil.
For my friend, I didn't operate on yet. I told him we'll wait. But I would do an EDOF actually. I would do an EDOF. I would keep him slightly micro mono. That's what I would do. So for my mother-in-law, I had done a monovision because she doesn't read or drive or anything. For my dad, I had done an EDOF because he's always very active. And for my mom, she likes to play cards, so I had put a trifocal. It depends what you want to.